to a couple of new faces that we haven't seen before. So today's session, we're just going to start. Sarah's going to talk just shortly about the training hubs and introduce herself. And then we're going to have a little catch up about the FCP pathway. And then we've got Brogan coming from St George's to talk about the university modules and what they can do for us there. So I'll let Sarah start.
Thank you. Thank you for having me today. So for those that I haven't met, I'm Zara Safdar. I'm the head of Southwest London Training Hubs. And I just wanted to come say hi to everyone, kind of tell you where the paramedic forums have come from and kind of our vision for it and why you guys are kind of super important to be hearing some of this stuff. So if you haven't heard of training hubs before, they exist in, I'm just going to mute Brogan. Okay. If you haven't heard of training hubs before, they exist in every ICS. So we have like a Southwest, Northwest, North Central, Northeast and Southeast London training hubs. And under the main umbrella, you have your borough-based training hubs as well. So they're very well positioned to have kind of the strategic at scale stuff from an SWL perspective, but also have the local relationships from a borough perspective, which doesn't really exist in kind of the new ICS systems we're all living in. Our main remit is out of hospital, workforce development, CPD, recruitment, retention, and probably everything in between. So they're really large remits. We are funded through the old Health Education England, which is now called NHS England, WT&E. And so therefore we come from a very educator's perspective on when we are pulling programs together, CPD, workforce development. So a couple of things that are quite specific to the paramedics world. These forums are funded, or Ellie and James's time to pull these forums together is funded through business cases that I will put forward to the ICS. So I can promise you that if we don't get the engagement and the evaluations back and your feedback on how these are working, we will never be able to carry things like this on. I do think that they're much needed. I think that these are safe spaces that I think we are in a multi-professional world, but I equally think we do sometimes need silos of profession to be able to get together with their peers and discuss their challenges and things that are specific to them, but equally be able to access the multi-professional stuff as and when they need to. I think we're in a really fortunate position that the ICS have agreed to fund the paramedic forums this year. So I think my one really important message would be, please speak to friends and colleagues, please encourage them to sign up. We are trying to get the dates out in advance as much as we can. Please tell Ellie and Jane. The reason we've got paramedics leading the paramedic forum is because as peers, you can then say, this would be really good to do later on in the year. They are there as your resource. So please use them as much as you need to. That's one part. So your attendance is really, really important. The second part is if you haven't come across the Southwest London Training Hub's website, Nisha, I can't copy and paste while I can't multitask weirdly, even as a woman. If you put the Southwest London Training Hub website in the chat for me, everything is open to you guys all the time. So I know some of you might be on my mailing list and probably get emails from me. Just assume it's open to yourselves. You can also go on the Training Hub website itself and look at things. We are making that single point of access where you can go and look for anything that you need to. But equally, if there are training needs we are not covering, I'm hoping that this forum will start pulling together a training needs assessment of actually what do you need that's different to what the rest of the workforce needs. So I completely recognise that training needs for different staff cohorts are different. And if you're new to primary care, and you're doing a slightly different role, as much as we try and do everything from a multidisciplinary perspective, we can't ignore the fact that different professions will have different needs. So my message in that is tell us. We will always try our best to either find the funding or a free way of doing things, but we're really committed to making sure that we're able to retain you guys more than anything else. On the recruitment end, you might have seen an email from me yesterday. So placements is a large part of the day job that we do. So even though you see lots of courses and forums that come out in emails, actually, in terms of our KPIs with NHS England, a large part of the job we have to do is the pipeline into primary care. Paramedics have not traditionally sat in primary care, so we've not traditionally worked with the universities on doing student placements into primary care. So one of our big pushes is we want to put more students as placement students into general practice settings. Until you have exposure to these environments, you're never really going to Google search a job there. You're never really going to try and find roles that work there. And we want to make primary care an appealing place where paramedics will want to work in the future. I know that comes with a little bit of a caveat that the tariff is really rubbish. I know it's rubbish. There's nothing we can do about the tariffs. And I promise in every national meeting, every training hub around the country bangs on about it, that you're expecting a lot from us for 140 quid a week. But I think my messaging around that is we will keep banging on the doors of the policymakers. However, if we want paramedics to choose primary care as a destination, we do need to find them homes to do their 1 week placements in. When GPs see that email, they seem to think that all the supervision has to happen through them. It doesn't. You guys are more than capable of supervising the students. And if you feel like we need to upskill you guys with the supervision trainer skills, please tell us. So there are courses already available. If you're interested in becoming a multi-professional supervisor, at the moment there's a call out for courses which are starting in January. We also have a multi-professional faculty, which is basically a safe space for all professionals who do supervision, training, mentoring, whichever word you want to use, because you all look after staff in your practices. We can direct you to the faculty, and the faculty is led by two amazing clinicians who have huge amounts of experience. We had our first one yesterday and we had such a great mix. Didn't have a paramedic there, I don't think, but we had pharmacists, social care workers, social prescribers, GPs, nurses, and actually the common messages we were seeing is that they are having to supervise across professions. So if that is something that we need to work with you guys on, please shout. Again, use Ellie and James as your kind of main points of contact, and we meet with them regularly so they can feed things up to us. If there is a gap in terms of placements, I would always be encouraging our experienced paramedics that it's a really nice part of the job. I know it's work, I know it's soft, but once you've started mentoring students, you will get so much value out of it. And the bigger picture being, we might recruit them into Southwest London or somewhere in primary care. I think I was only supposed to speak for 5 minutes. I feel like I've gone really over. Sorry, Ellie, James. So they're my kind of key messages. I think we're really keen to support you guys as a group. Attendance in these forums is really important to us. We do have to report back on the numbers and things like that. So speak to friends, colleagues. If there's days and times of the week that work better for you, tell us. Nothing is set in stone. We will go with what you guys need from us. And I'm still here for a couple of minutes if you've got any questions for me.
Thanks, Sarah. Yeah, I think just to highlight as well that the Training Hub's website, I think Nisha's posted, it's really useful. There's loads of CPD on there. So definitely have a look and see what you know is out there. So might as well use it.
Yeah, and anything you got, anything that you guys might need. So if there's some specific CPD that we assume that you know, but you don't know, even if it's stuff like, gosh, I have no idea what QOF means. Oh my God, CQC is coming in next week. I've never dealt with them as a general practice or PCN staff. It's very different dealing with things like CQC and trusts compared to dealing with them when you're practice staff. Just shout. We're likely to have stuff like that. So it doesn't have to be clinical is the other thing. It could be just practice related stuff. Like Zara, you've said 5 acronyms. I have no idea what any of them mean. So just let us know. And Ellie and James, thank you for all your work that you're doing.
No worries at all. I just wanted to say as well, just further to that, please do drop Ellie or myself a message or email if there's anything you need at all. Again, it does not need to be something that's clinical. It can just be something that we can look in how to improve these forums. And again, you're sort of, it's something that we all want to try and build up and build our engagement with. So it's really helpful to hear what we're doing well and what also maybe we need to think about in terms of improvement or engagement. So I think, yeah, just making sure if there's anything you need or from myself or Ellie or the Training Hub or anything you're interested in us covering, then do reach out to Ellie or I.
Thank you both. And I'm so sorry I've got an INT event. I didn't realize there were so many clashes today, but have a great forum and I'll catch up with you all soon.
Thank you. Perfect. So I'm just going to talk about the FCP stuff, and then hopefully I will be able to share my screen. So can you see anything?
No, Ellie.
Let me try again. It's not coming through.
Will I share them?
Yeah. Oh, can you see it now?
Yeah, you just need to
Yeah.
put it into presentation mode.
Perfect. How's that?
Hasn't changed for me.
Let me try again. Anything changing?
No.
Okay. I can see it in presentation mode, but I don't think you can.
No, it would be quite small.
Okay. Are you able to share it for me if I try and start?
Yep.
Yeah. Okay. Yeah, perfect.
Cool.
Great. So perfect. So I'm just going to talk about, hopefully everyone is aware that when we're in primary care, we should either be on the FCP pathway, so the first contact practitioner, or the ACP pathway, the advanced clinical practitioner. But fundamentally, everyone needs to sort of have started with doing stage 1. So these really are the 2 e-learning modules that you can see here. So the top one you need to complete, and the second one as well, the 2 links there. So they're essentially e-learning modules. So they start with everything from, a welcome to primary care, what does it do? And then, some more clinical ones there as well. And the other thing I just wanted to point out is that when we're FCPs, when we're starting off as well, should be getting daily supervision. I think this is really important because I don't think that that's necessarily true for everyone in primary care. So yeah, daily supervision. You should be getting a debrief at the end of each day or each session just to go through things. It's to support your learning more than anything, as well as obviously the safety aspect when we're starting. But I'll share the slides, and then obviously you'll have the links to everything. But Nisha, are you able to go on to the next slide, please? So stage 2 is the portfolio. So this slide is sort of information overload, basically. And it is quite a big document, and it is a lot to get through, and it can seem pretty overwhelming, to be honest. Even sort of areas where it says, a reflection every week, or sort of 40 patient satisfaction questionnaires. It's a lot of work. So it's all there. And then on the next slide, I'll show you the link to everything as well. So Nisha, are you able to go on to the next one and then click on the top link, and hopefully it will open up a document?
It's opened up for me, Ellie. Can you see it?
No.
Okay, I think I need to stop sharing and then reshare.
Perfect. Yeah. So this is the document, and as you can see, as you go through it, it's another massive document as well, and piece of work. So it starts off essentially by telling you, you know, why they've done it, what an FCP is, what an ACP is, and then it will go down and it will take you through essentially, if we could go down to sort of page 25, Nisha, if that's okay. So yeah, it sort of starts us off here with it talks about the e-learning modules that I sort of spoke about a minute ago. And then hopefully a bit further down, it will take us through to stage 1, stage 2. Yeah, perfect. And so it talks about everything. And then, sorry, as you keep going through the document, it then shows it as these are all the different things that you would need. This is how you would build the portfolio as well. And then the only other thing that I wanted to show you is right at the bottom is the mapping. It's the SOPs that you should be matching your sort of criteria against. I feel like today it's probably going to be too much to go through every little bit and every little sign off. So best thing is, if you're going to go down this route, is to have a look at it, print it off. It will be a lot clearer then as to everything that needs signing. And then, so essentially what we're looking at is right at the bottom is the SOPs, which you probably would have done as a foundation or BSc. And it just essentially looks like this. And you just have to map up against each thing.
Are these the SOPs, Ellie?
Yeah, you're perfect. Yeah. So all of these, these things that you would have to map against. It's a lot of work to do when you're also working full time and everything else that goes on with life as well. So recently, basically what they've done is they've changed it slightly. So what you can do is you can use university modules to map against this document, which I think is a better option. So for example, you know, if you were to do a university module at an accredited university like St George's, then they would be able to sort of use that course that you've done. So for example, there's a part on quality improvement. If you were to do a module in quality improvement, you could just use that to map against it, and you don't have to do so much of the other stuff as well. So you can just do the modules and then map it against the document, which I think is a better route. It's obviously worth noting as well that once you're an ACP at the minute, there's not actually a verification process for this modules and this document. So it's just a case of, you know, try and watch and wait. The only other thing I wanted to sort of bring attention to, if we could go back to the PowerPoint, Nisha, if that's okay. Is the appraisal toolkit. I don't know if anyone uses this. It's on something called 14 Fish. And then I don't know if it's going to open without a login on your computer. Hopefully it will. But basically, this is a really good portfolio toolkit. And it's great for appraisals. It's great for, you know, if you get called up with HCPC, you can put everything in there. So any CPD that you do, any sort of, you know, compliments, complaints, any learning that you've done, any feedback from colleagues, it can all go on there, and so practice can use it as part of your appraisal. But also you can submit it to HCPC if you need it too.
Would it be helpful if I showed mine? I've got 14 Fish. I'm happy to share my screen and just show you sort of what sorts of things we're looking for. Let me just... So let me just do this now. I'll share my screen. I think 14 Fish is probably one of the better platforms that exists. Again, just generally with, I mean, I think it's sort of, you don't want to be in that 10% with the HCPC that gets pulled forward. Thankfully, I've been lucky so far, touch wood, to avoid it being pulled in just yet. But I think generally just I think when you're having annual appraisals, again, as Ellie said, it can be really helpful just to have a document to reference to, and you can share this also with your managers and get them to cross-reference things. So there's also integration as well. Let me share this screen so I can show it a bit easier. Here we go. Time screen. Here we go. Can you see this okay?
Yeah.
Perfect. So essentially, they offer you sort of free modules on occasion as well. So even though sometimes it's subjects that aren't maybe too relevant to the paramedic profession, but also it's useful just to know, I find, because actually sometimes it's just looking through the notes and you'll see that, okay, well, this all seems a bit odd. I want to flag this to a GP, and I think that comes a little bit into the supervision side of things. If you're not practicing at an advanced level, if we go through, I'll show you mine just so people can see. So you can talk through essentially what's your scope of work. You can track sort of what you're doing, and also you can integrate your appraisals in here. So yeah, essentially it will talk through sort of what we're looking at. We have sort of like your declaration, significant events, complaints, things like that, which you want to be looking at, and then again sort of PDPs. You can also, I believe, do surveys. So this is this is quite helpful. Collecting feedback on me, and you can either do like a 360 survey with colleagues, or if you're looking for more of sort of like patient feedback and data, then patients can also fill these out. And there are templates for patients to use as well, just discussing sort of how the consultation went, how you can improve. So again, that sort of looks at, a key part of it, if you're looking to do the ACP roadmap or FCP roadmap, is reflective practice. And I think if we look a little bit over the document that Ellie shared just now, actually, it is quite wordy. I mean, that FCP roadmap, I don't know the pages from the top of my head, but it's not a short document, I think it's fair to say. So it can be a bit wordy, but actually I think lots of the sort of aims and goals in there, if you boil them down, actually they're probably things that you're doing more often than you think if you're working in general practice or primary care. So I think, try not to let it intimidate you too much if you're looking to go down that route, because I think actually lots of these things are things that we naturally would do as paramedics each day. So it's just really, I mean, writing it down, recording it as a learning event and as an activity, and then getting that sort of countersigned. So yeah, that was just what I wanted to add in that bit.
Yeah, thank you. That's great. I think that sort of sums it up perfectly. Is anyone actually FCP, ACP? I think we're a bit of a blend, possibly. FCP, yeah. Is this something you guys have sort of started doing, have seen before? Is it something completely new? Working towards, yeah.
Well, I mean, obviously, if people feel comfortable talking, then that's brilliant. But does anyone have any observations about the FCP pathway that they'd maybe like to share? I don't want to put anyone on the spot, but I think maybe, obviously, there's lots of different routes and there's not one that's standardized. Do people have any observations on that, or anything they think maybe needs to be done differently or could be improved on? So what did the FCP cert?
Go on, Lauren.
Hiya. Yeah, I'm doing it through the sort of Agilio platform, Clarity, and I've done stage 1, so now I'm just working through stage 2, and I'm finding that's quite good. The Agilio platform is quite good to use. It lays it out quite nicely for you, because obviously that document's really quite heavy. So yeah, I'm just working through that now with my GP supervisor. However, I think I mentioned in the last time that we all sort of spoke, I'm my GP supervisor's first sort of paramedic. So we're kind of a bit blind leading the blind in terms of how we're officially getting it all signed off and how often we're supposed to be kind of meeting. I have a supervisor every day that I meet with after every clinic. And then I have protected time about once a month with my supervisor where we try and do some case-based discussions or sign off some COTS or something. And I guess we were just wanting to know, I guess, gauge from other people if they're doing a similar thing or if they're being more heavily supervised, if she's supervising me enough, just kind of what the norm is, I guess.
Yeah, so I think they say it, so yeah, it should be daily, and then essentially I think they say it's every 6 weeks for like a more in-depth tutorial. So I think I think she's they're doing the right thing.
I think Matthew has something to say. Yeah, Matthew, go ahead whenever you're ready.
Yeah, thanks, James. I completed mine about 18 months ago now. I was one of the first cohorts in Merton to do it. What I would just say is just to kind of reiterate what Lauren said a little bit. She seems like she's got a pretty good handle on how best to do it, particularly on the kind of supervisor stuff. What we did kind of managed to do is get a good like 2-hour sit down with my GP mentor every month to go through some case-based discussions, try and sign at least a couple of those off for a month. But I think the most important thing I found was, which we didn't realize at first, is you don't just need, well, unless it's changed, we didn't need the mentor to sign everything off. Other GPs, as long as they're trainers, can sign them off as well. So just make sure that it doesn't have to be every kind of conversation you have with after a home visit or a patient or anything like that. But if there's anything significant or a decent conversation, make sure you log that and just send them the form to fill in. And then as long as you're doing that as many times, you might not get every single one back, but I found I got at least 2 back a week, 3 back a week. And that really does kind of, as long as you're continually doing that, it doesn't back up and back up. 6 months down the line, you're kind of like, gosh, I'm halfway through this and I'm nowhere near finishing it. Just to make sure that you just kind of keep like plugging on and using lots of the different GPs to do it.
Yeah, absolutely. And so I think the only thing that's really changed since probably when you did it was the fact that you can now use university modules. And I think they're kind of quite actively encouraging people to do that now. And I think personally, obviously as well, if you start doing uni modules and you're getting level 7 credits and, or if you do your prescribing, all these things are great sort of professional development and come with sort of different perks, I suppose. So it's just another route really. But does anyone have any more questions, thoughts about the FCP stuff? I appreciate it was a whistle-stop tour about quite a lot of information.
I think just an observation, actually, it seems like there's lots of variability between obviously surgeries in how much time they're making for paramedics to actually complete the pathway. And so it's interesting that I think the FCP roadmap that you showed us is so prescriptive, but actually the time on those who are supervising is much less prescriptive, because I think, and I think it's good to, there's some maybe, you can use university modules to top things up, but actually I think having that prescriptive supervision within the document would be helpful, especially with the pressures. I think at the moment, surgeries are just not having enough time, I think, to supervise and to debrief optimally, or so it can be really tricky. So just interesting to hear what everyone's experiences were on that.
I think, well, if there's nothing else, questions or thoughts, I'm probably going to hopefully pass over to Brogan if she's here.
She is here, Ellie.
hopefully.
Hi, Ellie, I'm here. I have two.
Hi.
One for there's not beat. Yeah, so give me a second. I'm gonna see if
Perfect. Just whilst we wait for Brogan, is everyone getting sort of daily supervision, weekly supervision? What does it sort of look like?
I mean, I personally have like supervision just sort of as and when I request it, or because I think it sort of depends, doesn't it, on the scope of the workplace and sort of how long you've worked there, what their experiences are with paramedics. Do you have any supervision, Ellie?
So I get weekly, but we also, the way we've started doing it now is they have like a supervising GP. So each lunchtime they sort of look after the regs, paramedics, PAs, and so we all go up and talk about things or any interesting cases. Yeah, technically I just get weekly. Yeah, I see a few other people sort of saying weekly ad hoc. Perfect. We can see your slides.
Okay, I'm guessing you can see me too. So sorry to interrupt. I wasn't listening.
It's okay.
Do you want to continue discussion or do you want me to get started?
No, by all means, carry on.
All right, lovely. So hi, everyone. I know some of you, I recognize some familiar names from our program, but for those of you that don't know me, my name is Brogan. I'm the program director for the ACP program here at St. George's, which is what you probably know it as, but as of the 1st of August, we've become a merged university, and we're now City St. George's, University of London. So Ellie asked me to come today to talk to you a little bit about advanced clinical practice, but based on the conversations you've just had about FCP, I will include some information about our PG Cert FCP program as well. Really happy for this to be informal. So if you have any questions as I go along, you can pop up a hand. I should be able to see it. But Ellie, if anyone has any questions, you can feel free to interrupt me as I go along because I can't see. Lovely. So most of you know a little bit about advanced clinical practice, I think. So it is a level of practice that involves some independence, lots of decision making, and it's carried out by experienced registered healthcare practitioners. So all of you, of course, are on paramedics, but you can see in this circle that there's lots of other practitioners that can be advanced clinical providers, ACPs. On our program, we have nurses, occupational therapists, physiotherapists, and of course, paramedics. And so ACP is a really multi-professional mix. ACP is also underpinned by what we call the 4 pillars of ACP, which are expertise in clinical practice, in leadership and management, in education and supervision, and in research. So if you become an ACP, part of the process within the modules is showing expertise within these 4 pillars. And I'll come back to those again and again when I talk about our program. So we run a few different programs here at City St. George's. We have the MSc in Advanced Clinical Practice that has one intake a year in September, and there's different pathways within this program. So the general pathway offers the most flexibility. Those students take all of our core modules and then have lots of optional modules that you can take that kind of fit your clinical and workplace needs. So there's about 75 credits of choice within that general pathway. We also have a musculoskeletal pathway, an urgent emergency care, and a critical care pathway. Most of our paramedics working in primary care take the urgent emergency care pathway. I don't know, Ellie, I don't know if you want to share, was that the pathway that you took or did you take the general? I can't remember.
So I did the general because of basically down to the optional modules that I chose. It just worked out that way for me.
Yeah, exactly. And so all of these 4 pathways are advanced clinical providers. They're all ACPs. They all get the same degree, but just some of them have a different title kind of after it. So it depends where your interests are, where your workplace needs are. So most of you, if you were considering the ACP, would be probably looking at the general or the urgent emergency care. We also have PG Cert programs in clinical practice. So this is a 60 credit course. And because it doesn't have all 4 of the pillars, it's not advanced clinical practice. So we just call it clinical practice. And you can see here the 2nd and 3rd bullet point. Those are our first contact providers, our FCPs. The one that you'd be looking at, of course, is the FCP Paramedic one. So this one is accredited by NHS England. So as we were talking about before, there are a few ways of becoming an FCP. One would be the portfolio route, and one would be to take modules or just a program at a university that already has been accredited towards FCP. So the modules that you take as this PG cert in clinical practice, they meet the requirements of NHS England for you to become an FCP paramedic. So we've done the mapping for you of our modules. So if you're looking to join the ACP, these are our entry criteria. So for most students, they need a 2-2 undergraduate degree, need to be a registered healthcare professional. And in general, we look for 3 years of full-time clinical healthcare experience. Most importantly, you need to be employed in a role where you can actually practice those 4 pillars of ACP. And so for you in GP, it's a really easy place to be able to practice your research, your clinical skills, your leadership, and your education. So it's a really nice place for paramedics to be when they're going down the ACP route. And of course, you need support from your employer because most of our employers fund our students. And also you'll need to complete hours and have supervision there. So that support from your employer is really key. If you're looking on the PG Cert route or the FCP, again, it's similar requirements of a 2-2 undergraduate degree, but this time it's a little bit less time in clinical healthcare experience. So at least a year full-time. Most of our FCPs have more experience, but at least 1. And again, support from your employer is always going to be important because we have so many modules that require you to be getting supervision in your workplace. Okay, so the MSc, the master's degree, is 180 credits. It's 3 years part-time. The PG Cert is 60 credits, so it's 1 year part-time. The PG Cert is often a little piece of the MSc, so you can come get your PG Cert, become an FCP, work for a bit as an FCP, and then you can apply those credits toward your ACP. So they're not completely separate credits. They're within our program. Students on the PG Cert are taking modules alongside ACPs. So it's a really good kind of step towards an MSc. Our program is what we call modular. So you take 3 to 4 modules per year. And usually they run for kind of a chunk. So maybe 5 or 6 weeks where you come 1 day a week and then take the assessment and move on to the next module. And of course, what modules you take depend a lot on what pathway that you're on. So our core modules are modules in the ACP that everyone takes. So we talk about these pillars again and again. So if you are working towards your ACP, these pillars will become embedded in your mind. But our core modules really reflect the importance of these pillars. So you can see them listed here. I won't read them all for you, but you can see that they hit those pillars. The last 2 are research modules. We have education, we have leadership, and the top one is starting to advance your skills clinically. So everyone that joins the MSc ACP takes these modules. As I said before, our students are multi-professional, and we think that's really important. So a lot of you, you're probably working in a multi-professional setting, and so you likely see the benefit of that already. So we really like to see the mix so that students can learn from each other and learn from different expertise. We have, as I said, nurses, paramedics, pharmacists, physios, occupational therapists in our program, and we take about 60 MSc students per year and about 20 or 30 PG Cert students. Because our students are a multi-professional mix, our academic staff as well. So if you come to learn with us, you will be learning from all kinds of different healthcare providers and researchers as well. You can see the little blue badge I've put down here is just a reminder of myself that we are an accredited course for advancing practice. So if you're looking to study as an ACP or an FCP, make sure that the program that you choose is accredited by the Center for Advancing Practice so that you can get a blue badge upon graduation. And really, you know that that program meets the standards of NHS England. Okay, so I'll pause here just for a minute to get you to take a look at this outline. So this is an example of the modules that you might take if you were on our urgent and emergency care pathway. So you can see, again, we talked about it's a 3-year program part-time. Every year you take 60 credits. You'll see there's one optional module in this pathway, and most of our students on this pathway take a remote and digital healthcare and consultation module as their optional. You can see there's drugs and PGDs, minor injuries, and minor illness. So kind of a good mix. You can take the urgent emergency care pathway with prescribing. It just looks like this. There's no optional module, and prescribing is in place of the drugs module. So that's an option. I will share these slides with Ellie, so I don't want to spend too much time on each of these pathways, and you can always look back to them. I don't think many of you will be interested in the critical care ones since you're working in GP, so I'm going to skip over this, but we do have a critical care pathway where students take principles of critical care. They take a neuro module and a trauma module. Our MSK module is relatively new. So this is for anyone working in MSK practice. They take a lower quadrant module, an upper quadrant module, and have an MSK placement along with optional modules. And of course, our newest pathway, which we're really excited about, we are starting intake for this in September, is our ACP in mental health. And so this pathway was just approved after conversations with NHS England, knowing that there's a need for ACPs working as mental health providers. And so this pathway allows for either prescribing or not, but there are 3 specific mental health modules taken, you'll see first in year 2 and then the last one in year 3. This also has one optional module. For many paramedics taking this, their optional module that they would probably want to take would be minor injuries. Fits really nice with that mental health interest. Then, of course, many of our students take the general pathway, and this allows a lot of flexibility. So you can see there's 5 optional modules, maybe 4 if you take a drugs and PGDs module, less if you prescribe. And I think on the next page, I might have a list of our optional modules. So our optional module package is growing all the time. We have modules in pain and palliative care, soft tissue and joint injection, a patient safety, diabetes module. Remote and digital healthcare is really important. The mental health module can be taken as well. And I know some of these are even new, I think, since Ellie was with us. With our merger with City University, this list of optional modules will grow. And so we're really excited about being able to really offer modules that are fit for purpose for you and your workplace. Another aspect of our course that is unique and I think is a really nice benefit is that we have something called professional practice days. And we run these just 3 times a year. But everyone in the cohort comes together, no matter what pathway that they're on, and we teach skills that are really important for all ACPs. Here's a couple examples of the ones that we did last year, and this year we have a really interesting frailty session. So these are always evolving and changing based on healthcare needs. So these can be a really nice opportunity for additional learning within the program. Here's an example of what somebody's 1-year schedule might look like. I know it's just a lot of writing, but you can see if you joined us and took advanced clinical reasoning and health assessment, education, and remote and digital healthcare and consultation, this is what the year would look like. So you can see in the autumn, there are lectures on Tuesday, Wednesday, then the following Wednesday, Tuesday, Wednesday. So in general, people are coming in once or twice a week, usually once a week. You can see then there's a little bit of gap before assignments and before the next module starts. So this is what kind of a classic first year might look like. And we recognize that you're working full-time, so we do try to be a bit flexible with how these modules are designed and run. In terms of student feedback, so we have lots of different assessment range methods that our students tend to enjoy. So if you join our program, you might write essays and do posters or presentations, projects, OSCEs, simulation. We also use a variety of teaching methods. So very rarely will you be sat in a lecture theater with someone lecturing to you. There'll be problem-based learning and action learning sets, simulations, lots of discussions, lots of small group work. We have a personal tutor system. We are publish our timetable about a year in advance, so you can start to plan your life and plan your work around it. And we are blended, so we have a mix of remote and face-to-face learning, probably 70-30 face-to-face, depending on the module. In addition to kind of our programs, so our PG Cert and our MSc, we also offer standalone modules. So if you were looking to just get a taste of level 7 learning, we have probably the ones that would interest you the most would be the essentials of mental health and the independent and supplementary prescribing. So those are the modules that you can just come and take those as is. Mental health is 15 credits and prescribing is 30. I know at the beginning we were talking about supervision and whether or not you supervise each other or supervise students. We also have a really nice workplace supervision module for CPD. It's a multi-professional setting where you come in and learn kind of principles of being a workplace supervisor. That runs in the spring, and we of course have a joint injection as well. So I've included the link on the slides. I'll put them in the chat, but as I said, I'll share the slides with Ellie who can distribute them to you. But if any of these modules are something that you're interested in, you can always reach out to me as well. So of course, as we look towards the future, we are in this process of merging with City, which will mean new opportunities, new optional modules, maybe new opportunities to learn at the Clerkenwell campus versus our Tooting campus, and of course, more standalone and CPD offerings. So keep us in mind if there's any CPD that you're interested in. Our application opens, is it November? It is November. Our application opens now for our September 2025 intake. I've put the fees here and I've put my email address here. If you have any questions about eligibility, FCP, ACP, any of it, I'm really happy to chat and give some more information. But I think for now, that's it for me, and I will stay for any questions.
Thanks, Brogan. That was great. Does anyone have any questions for Brogan?
I realized it was quick.
Yeah, that's okay. I mean, I will just point out as well that, you know, as Sarah said, with the training hubs, they do often fund. So the Health Education England will fund the ACP pathway, or they will fund some standalone modules as well. Do you still offer, it's not CRIPA now, is it? The clinical reasoning module as a standalone?
Not as a standalone anymore. Yeah. But City does. So our kind of merged university, City offers the advanced clinical reasoning, which is the prerequisite to the prescribing. So eventually we will. I've put in the link there about our standalone modules, and I'll put the link in the chat also about just the program in general. So this is the ACP. It has a lot of information on our website. If anyone is considering it. But you're right, most employers do pay for the program. So very few of our students are self-funded. There you go. And that's the clinical practice. We take FCP paramedics in September and in February. So if anyone really wants to get started soon on an FCP route, we do have applications open for a February intake of FCP paramedics or September for both the MSc and the PG Cert.
Right, everyone's gone quiet.
Stunned into silence. Well, as I said, I'll put my email in the chat as well. If you think of any questions, you can feel free to give me an email.
That's great.
Thanks, Ellie. Oh, maybe John.
Yeah, I don't. It's not that I want. It's not exactly a question. It's more just a statement saying that I'm currently just finished the first module in the second year of the ACP course, and I'm really enjoying it. And if anyone is considering doing it, it's a really worthwhile course to be doing. I think it's from what I've done so far, it's really good. So I just wanted to encourage people, if they're thinking about doing so, to apply for it.
Thanks, John. That's really nice feedback to hear.
Yeah, and that, you know, once you sort of, you know, you get the pillars or you get prescribing or do the modules, you know, it opens doors at the end of the day. You know, for future career options, you know, if you wanted to go into education or research, it's, you know, they're all building blocks.
Looks like Matthew.
Yeah, a couple of questions really. I did my FCP qualification through the LAS program a few years ago. At the time, we were kind of told that we would be registered by the HEE or put on a register by the HEE. I believe that then got rescinded and they decided not to do that. You were mentioning the blue badge that your courses have. Now, obviously, I need to kind of try and figure out what we do with the ones that we've done already. Do we, if I wanted to do the ACP, I've done the FCP already, do I just jump on that? And was that qualified for it?
It depends. Did you do it on a portfolio route or did you take modules?
The portfolio
route. We would have to look. So what we do, recognition of prior learning, that's typically recognizing prior modules that people have taken. So if you do the FCP at a university and you've taken these level 7 modules, you can bring those in, even if you haven't taken them at George's. I don't know if there is a pathway of recognizing the portfolio method as kind of prerequisite learning. We would need to do a kind of a mapping exercise of where the skills are in that portfolio and if it could count for any of the modules. So yes, it's a little more complicated, but happy to chat with you via email maybe about what that looks like.
Okay, lovely. Has anyone else on here had the similar kind of I've noticed a couple of names, similar kind of experience, and what have they kind of done regards?
Have you got a foundation degree or a BSc?
I have a BH honours, but in the arts, not in science.
Ah, okay. Because I said, well, yeah, I had a foundation degree, but because I said she did one module at level 6, you can, I believe, take one of your level 6 modules up. I don't know if that would transfer if it's not in paramedic science.
Yeah.
No, because I was a
BSc is fine in arts. Like it doesn't need to be especially if you've been working as a paramedic for a while. So it's more if you probably need the 180 credits to get your ACP MSc, even though you're starting as an FCP, just because we have to hit all 4 of those pillars. So I suspect my suspicion is that you would need the 180 credits for the MSc, but I can check into it.
When we started the FCP, we were told that this would be almost like the clinical pillar to start if you wanted to carry on and do the ACP, but then that kind of seemed to change and then got lost and nobody kind of got told what was happening.
Yes. So our FCP students take advanced clinical reasoning and health assessment, which is like an initial clinical assessment module, and then they do minor illness management, and then a portfolio. And so we I haven't had this question before, but we can look into kind of the regulations and the guidelines of how we might be able to give credit for someone who's practicing as an FCP who took that portfolio route. It's probably a question I need to talk to NHS England about and our kind of our quality team here.
Great, thanks.
Yeah.
I'm in a
Matthew,
similar
if it
position
helps.
to Matt as well.
So Dave, go ahead.
Sorry, thanks. Yeah, Matt, I'm in the same position as you. Did the portfolio route. So yeah, my foundation degree plus a bachelor's degree in something else for paramedic wise. So yeah, looking at the ACP route, I've no idea if any of our FCP portfolio would count at this stage.
Yeah, I see Dan's, I don't know if Dan's experienced with this. I don't know if I see he's on. We're not in the same room anymore. So I don't know if he has let's see if he's here. I'm guessing he would have chimed in if he had more to add than I did, but I'm really happy to look into it. I think it's an interesting case. So do you have a badge? Do you have a blue badge that says you're an FCP? Are you like accredited through the portfolio route from NHS England?
No, so we were told that we had to register. I can't remember what the actual process was now, but it was kind of we had to send our forms that was signed by the mentors to a body, and then they said they were not taking any further registrations, and then nothing kind of happened after that. Nothing changed. Nobody kind of knew what was happening. We were kind of waiting from the HE to decide what they were going to do. In the meantime, I've left LAS and I'm now working full-time in primary care, so I still have contacts there, so I know Dave very well.
I mean, it's tricky. Sometimes I think you might benefit from learning in a multi-professional setting, and if it's if it's funded by your employer, you might benefit from the 180 credits, and it might be enjoyable to kind of refresh some of those skills. But I can also see that you want recognition from kind of what you've done in the past. So yeah, happy to take it kind of to my team and see if anyone has done something like this before.
Great, thanks.
Yeah, so just to say, I did the FCP portfolio, which was signed off by a supervisor and my GP practice. I haven't used anything to do with that for in the ACP course. I've just gone through all the modules. They are quite useful. It's just, even if they're just as refreshers, they are useful modules to do. It just depends on whether you've got the mental capacity to go through more learning again, or whether you really want to try and cut that short as much as possible.
Yeah, I mean, eventually I think, and it's more time really and outside of work and stuff, but it's kind of trying to get recognition for the work that we've already done, at least.
Yeah,
it took us it was 2.5 years of slog through that. And because we were the first 12 to kind of do it in London, so yeah, I just wondered if there's been any kind of further kind of knowledge on what they were decided to do with that kind of with those portfolios.
Yeah, I think it's an interesting question. I'll have to look into it more.
Matt,
I think it's a valid question.
Did you see the College of Paramedic record of achievement?
So I only saw that today, Dave. I saw your name on it, so I was going to ask you about that. Okay,
there you go. So yeah, College of Paramedics, for anyone that wasn't aware, has a FCP recognition of achievement list, and you can register on that list once you finish the program.
Cool. And is that, do you just send your signed certificate from your mentor then to them?
Yeah, it's mainly a sort of a self-disclosure thing, but then they contact the supervisors to confirm if needed.
Okay, lovely. Thanks, mate.
Right. Does anyone have anything else for Brogan? No.
All right. If you do, you have my email address. Thanks for inviting me, Ellie. Nice to see some familiar faces again.
No, thank you very much for coming.
All right. Bye, everyone.
Perfect. I don't think we've got anything else, James, unless you've got anything, or Nisha, to add.
Not really. I think,
no.
Oh, can you hear me?
Yeah.
Yeah. I think it's interesting. I mean, it just seems as though people have been left in the dark a little bit with FCP, somewhat, and also I think the fact that maybe, I mean, being ACP, if you work in primary care, I think is probably sort of the end goal for everyone, but it would be interesting if that could be officially recognised by the HCPC, almost as like an annotation. I've never really understood sort of why it's not, almost.
Yeah, I remember when it first came out, and I mean, I'd already been working in primary care, and it sort of felt like a little bit, as usual with the NHS, the cart before the horse. And it was sort of like, oh, hang on, we've got all these paramedics in primary care. What are we actually doing to make sure that they're, working at a certain standard? So I think that's why I just decided to go down the uni route, because I thought I would just want an actual recognised qualification at the end of it. And yeah, lo and behold, I think, within 2 years, they said, well, no, we don't really want to be recognising the FCP stuff anymore. And that's why now they're sort of saying anyone new should just be going through the sort of the PG Cert uni route. And it's just really frustrating for like you guys that have done, years of work on top of working full time and everything else. Yeah. So I mean that's why I pushed the uni route, because I think it's a more recognised.
But also within general practice, actually often employers won't be asking specifically for you to have done FCP or to have any intention of doing FCP. I think that's also important to mention. Actually, if you depend on the practice, I mean, I've never encountered a practice who has said you have to be an FCP for us to hire you for this role. Actually, the ARS sort of requirements are not that prescriptive in that sense. And so I think obviously it's frustrating because it's, you spent time doing it in a long period of time, but actually in terms of how that would impact sort of employment, I don't think it would be something that would be restrictive in that sense.
No, but I think
it's even beneficial, because actually you've got a record of prior learning that you can refer to that shows that you're reflective and that you've been certified as competent, etc.
Yeah. Well, I think if no one has anything else they want. Oh, go on, Laura. Sorry.
Sorry, yeah, I just feel like now I'm more confused than before because I'm doing this portfolio route, and now I'm like, should I scrap that and be looking at the PG cert if I'm thinking longer term? I'm just, like I said, my surgery weren't really sure either, and we just sort of said, oh, it looks like we need to do this portfolio route, so that's what we've started when I joined the practice in January this year. So yeah, I just don't know now whether I should kind of stop that and look to do the PG cert.
Yeah. So the only requirement is that you are working towards. So if you got some evidence there that will support you by saying that, well, clearly I'm working towards, that's all that you have to be doing, really. I mean, to be honest, my advice, and I'm biased because it's the route I took, would be to do the uni route, purely because I think it's just an investment in the future. Because I mean, I'm talking me personally, I don't think I can be clinically in a GP surgery for the next 30 years. And so having those skills like the education stuff, the leadership management stuff, research, even the prescribing, it just opens a lot more doors. And I think it's just, personally, I think it's an investment. But I appreciate that, not everyone wants to go to uni, not everyone has the time. That's my personal opinion. But
also I think if you are making that sacrifice of time and energy, like actually, I think if you did choose a university route, as you say, Ellie, you get something tangible out of it. I think with FCP pathways, just my personal view, I'm not sure what that would necessarily change in terms of practice long term that ACP wouldn't. yeah, that would just be my thoughts on the area. From a practical standpoint, with things like prescribing or developing your practice, actually, yes, it's important you're demonstrating that by doing FCP, which is great. But I personally wouldn't. I didn't choose the FCP. So yeah.
Yeah, because my next, after getting the portfolio completed, my next stop would be to do my prescribing. So
yeah, and also that's why I asked the question. So to get onto the prescribing, you need to have done the clinical reasoning module.
I've done the level 6 one.
So that might be enough.
Yeah.
That might be, but it's just something to think about. I mean, and also I think ultimately, if you sign up for the ACP, I think you have to do it within 5 or 6 years. So I think there's no sort of obligation to just follow that pathway like Brogan's done. I mean, I think when I started, I did the clinical reasoning in the December 2020, like a COVID time. And then, I think then I had probably a year out before I did my next module. And then it was quite broken. That sort of first one she showed you was generally what like CCAM, the PPs follow that pathway. So that's what a lot of them do. But I didn't do some of the core modules. I did do some of the urgent modules. I did, I picked, there's one on chronic pain management, which I did. There was one on like behavioural changes, and I did that instead because I thought that was more interesting. So I think it's worth looking at the modules and thinking that, you can do things that you are interested in, and it's not all just like general practice urgent care.
I think Alex has a question. Can you go straight to ACP course without completing FCP? Yes. So FCP is not a prerequisite at all for doing ACP. Actually, ACP, obviously there's different requirements per each university, but the general requirement is that you have been registered for a period of between sort of 3 and 5 years before you embark on ACP. And even with prescribing as well, certain universities will say, well, you need to have completed clinical reasoning modules. Lots of universities that offer prescribing don't have that requirement. So I think, FCP is not a prerequisite, just to answer that question.
No, as long as you do those e-learning that I showed, I'll send out the slides and that as well. But I think as long as you have to do the e-learning modules, that's the only thing. And then, like I say, at the moment, ACP verification portfolio does not exist. So it will happen at some point, I suspect, for them to say that we're, ACPs in primary care. But I would say we cross that bridge when we come to it, and all the modules that you do will cross-reference against the portfolio.
Yeah,
so
so
John's just made a good point.
Yeah, so I think Georgia's have almost like a it's not like a sandwich course, but like a combination course where they apply those two. I think there's one physical examination skills as well at Georgia's that can be done supplementary to the prescribing modules as well. So I think it's like a year-long course at Georgia's PG Cert.
Yeah, and you can do the prescribing at level 6. So I think there's a question for you, Dave, from Lauren about the College of Paramedics. I have seen it. There is a list.
I'll find you the link now and post it in the chat.
Thank you. So that's for the FCP stuff.
It's only because I've done a lot of it, so now I'm just pondering. Yeah, and depending on if you're struggling on certain areas and you want to do the ACP, you can always just use the module to finish it up, or
carry on. It's
Mm.
it's food for thought.
Yeah.
Yeah.
Lots of chats to be had.
Yeah, I think there's lots of options out there. I think you just have to pick what's right for you, really.
Yeah. So there's no actual real framework or scope of practice for us as paramedics in primary care as it stands.
No, none that's defined at all. I mean, the FCP roadmap used to have, I think it still has sort of stage levels of what your levels of practice are.
Yeah.
But those do not, I mean, I was reading lots of those. I don't think those are especially helpful in classifying sort of what we do, because there's such a difference in each paramedic sort of practice and what our background is, our training. You know, actually nothing is standardized, and so I think my opinion would be that actually when you have such a lack of standardization with different workplaces, different employers, my concern would be that with the FCP pathway that is maybe perpetuated, because that also doesn't seem to have much standardization or equate to a real sort of increase in scope that's recognized. But it is good learning. I mean, I think, it is really good learning. It's reflective learning, and it's a helpful document that shows that you're, safe and effective.
Yeah, I think the key as well from like an indemnity side of things is just, what is your job description? Are you sort of working within your job description? That's kind of that is your scope, really. And so, if you're doing asthma reviews, you need to have the way I see it is some sort of e-learning or a certificate or, something to sort of say, I've got a qualification in this. I think the thing I struggled with coming to general practice was like, oh, the GP's shown you how to do it, so that's fine now. And I always kind of felt a little bit uncomfortable with that because, how could I sort of evidence that if there was an issue? I think particularly once I started prescribing, that's when you also need that sort of scope to say, I've done this module or I've done this online stuff. This is why I can, prescribe certain things. But I think the portfolio, and I think, so yeah, the 14 Fish or the Uglio, which, whatever platform you use is just a good resource to keep things in one place. Matthew?
Just on that kind of scope of practice, I think from the very beginning, I sat down with my mentor and we just kind of just decided on what kind of areas, one, that they wanted me to focus on, two, what I wanted to focus on, what I was interested in. And my portfolio was based around that, really. And then we kind of almost drew our own scope of practice. The problem with the roadmap was that they just tried to put too much stuff into it and you just physically couldn't do it all. I think they just needed to streamline it into kind of the basics of what we do need every day, and then have some options to kind of almost kind of decide yourself which kind of area. So, for example, I went more into kind of frailty, dementia, housebound patients, because that was what they wanted me to do more of, and that's what I was interested in. So, I think as long as your portfolio can evidence that you've done that work and you stick to those kind of areas, then I don't think you have an issue on kind of on an indemnity side of things. It's when you kind of get asked to do extra stuff and you've already completed your portfolio and you've not really done that, then that might when you get a little bit unstuck. So I think, again, that goes back to CPD, I suppose, and making sure that you're doing extra stuff to make sure you're covered. But as far as the portfolio is concerned, Lauren, I wouldn't stop doing it if you're that far down the line, particularly now that, I mean, the Royal College, I mean, I don't know if you're part of the Royal College, but they give you the indemnity if you're part of them. And if they're recognizing your FCP portfolio, then I think that's a good step in the right direction.
Yeah, that's really helpful. Thank you. Yeah, and like we touched on it earlier, the whole reflective element of the portfolio is really good, and it's forcing regular meetings with the GPs and supervisors to go over things and learning taking place. So yeah, it's all food for thought.
Yeah, and I think, you know, the earlier on you sort of set some boundaries about what you feel comfortable with seeing, you know, because we're all different and we all move at different paces as well. And, you know, you can add to your scope, you know, it's not sort of set and done straight away, but you know, if you're not comfortable seeing under fives, just say don't see under fives, or you know, it's I think sometimes we can feel a little bit pressured with this sort of need for more appointments, see this, see that, reception book things in that are a little bit inappropriate. I think it's it's sort of key to sort of work out what your boundaries are. Perfect. Is there anything else? No, I appreciate we've sort of probably had 25 minutes of us all just chatting now, which is great. That's what we're hit. That's what this platform is for. You know, we want more of the peer support stuff. So, you know, the more we share. But I'm sorry this wasn't face to face today. This was the original plan, but as you can probably see with the numbers, it wasn't quite the uptake we were expecting. But if anyone has any thoughts on why we're not sort of reaching people or people aren't coming, we'd really appreciate that feedback, because ultimately we want this to thrive and we want to be reaching out to more people, and the more paramedics we connect with, then we can get an idea of someone might answer some of these questions.
Ellie, can I just add the reason for not meeting face to face was purely numbers and like not kind of cost of building and place and all that kind of stuff, was it?
Yeah, so it was all funded. There was funding for lunch, and ultimately actually the training hubs probably lost a little bit of money because they would have lost a deposit for the room and everything. So this is all funded by them, and it would have been a bit odd for what 6 of us to have been sat there together. So that's why we sort of moved it online, and then I don't know if since we moved it online, if any of you guys have joined because of that, or whether you were all committed to the face-to-face originally. But I would really like a face-to-face. I think it's a really good way to network and get to know each other, but it doesn't seem to be happening.
And clearly there's lots of issues as well that it seems have been raised sort of generally, either about pathways or feeling supported or scope or advancing practice. And so I think just going over sort of what Ellie said there, actually we want to try and continue on with keeping this sort of forum open and encouraging discussion on these areas, because I think actually paramedics working in primary care are quite a rare breed generally, I would say, when you look at general practice and the professions that are working within that area. So I think we want to try and keep this up and open as much as we can.
The only thing that I was going to say about potentially reasons why people haven't been able to come, because it's quite a long time out of a working day. So I was fortunate that I just took it as a study day, and that's why I was able to consider coming for the whole of the session. But it is a long time. It might be easier if you have it like more towards one of the ends of the day, and people might be more able to attend that kind of meeting where you say, well, so I'll finish early or I'll start late, and at that point you can then say, okay, and then you also include like the less formal, just sitting around and chatting type thing as well, which might be I would find interesting and useful, I think, as well. so I was looking forward to being able to meet lots of other people who are in a similar position to me, just to see what people are doing, really. And I was quite sad that it turned into what is a useful forum, but not quite as easy to communicate with when all online interactions are not as easy as they are face to face. So it would have been nicer if we could have done this face to face, but it is what it is.
Yeah. So do you think something less, like fewer speakers, more networking, social type event?
Yeah, I think so. I think that if the focus had been almost purely on networking and meet people who are doing the same thing as you, and you can have chats, and like food being provided would be nice, but not necessarily as vital as just the actual being able to meet people and just say, oh, where are you doing? What sort of thing are you doing? How have you progress? How are you finding it? And then you could just be a little bit less formal about it, rather than having people coming in and having that kind of the speakers on, like, obviously talking about all these things, useful, absolutely. But I think in terms of the most valuable thing I would have found would have been to be with people and just to have that thing and catch up with people and see how they're getting on, really.
Yeah, really agree with that, to be honest with you, John. I think, our plan for this is for it to be informal, but also for there to be sort of that educational aspect to it, and I think there's nothing like face-to-face. I mean, Teams is good for some things, but there's nothing quite like a face-to-face. And so I think, it would be really, really important. I would really like for that to take place as well. And I know that that's something that Nisha and Dara have been talking about as well, with us sort of making things more interactive and sort of face to face rather than online. So I completely agree and share what you said there.
I think obviously next month is sort of December. I don't think we've actually got a forum planned next month, Nisha, have we?
No, we don't. And I was just looking in the diary. I'm not sure that we've planned future forums. So I will send out some communication by email, and we're still gonna definitely try to do our face-to-face next year, probably around March, maybe. Yeah, we really want to make this a success. So thanks, John, for your feedback. Maybe we can do like an afternoon starting about 2:30 to 5. I think that will be more feasible for people to be able to get out, or even 3 to 5. But yeah, we'll plan it all and send some comms out for future sessions. Thanks everyone for coming.
Yeah, thank you. And thanks obviously for everyone engaging and submitting really useful feedback for us as well.
Yeah, absolutely. Thank you.